with Dr. Jack Zamora from Cosmetic Surgery and Aesthetics in Cherry Creek, and we've been having such a good time talking about all the things that I can do on my face that last one day. They don't cost a lot. You're amazing. You're like a magician, and you look great. You look great. We're talking about your eyelid surgery today. You're called the eyelid guy, right? And even other plastic surgeons refer their patients to you. That's how good you are.
Well, it's an honor and a privilege, but we've had some nice results, and just want to keep doing it.
Keep doing it. Yeah. These are not just nice results. These before and after pictures are amazing. It's like an art. It's what you do.
It's a passion. I've known I wanted to do this since I was 16.
Really?
Absolutely, and it's fun. It's a blast.
Tell me about what the procedure is like. What can people expect from this procedure?
So it depends if we're doing the upper eyelids or the lower eyelids. The upper eyelid surgery is what we're going to do today, and it's very simple. A simple in-office procedure, very little pain or discomfort associated with it. Okay. And then just 5 to 7 days later, you have a good level of healing where you can go back to work.
So you're repairing the eyelid either on top or just the top?
So today we're going to be removing a little bit of that excess skin that sits on top of your eyelashes where you have a little bit of hooding or where you can't put your makeup on anymore because of wrinkling and all of these things that happen as we get older.
As we age, and some of it is genetic, too.
Absolutely. Just because, like your eyelids, we were talking about this earlier, you're not going to need an upper eyelid surgery forever, probably.
Hopefully.
But others do. And so for those patients, we have options that are either non-surgical or surgical, and today we'll be exploring some of the surgical options.
So is this pretty common? Do a lot of people do this?
One of the most common procedures performed in the U.S. So,
doctor, if someone's interested in getting this procedure done, what is the process? They need to come in for a consultation first, right?
Right. We want to make sure that you're the correct candidate. Do you even need eyelid surgery? Secondly, how bad is it? Is it bad enough where you might even have insurance cover it? And so we really want to have you come in, see if you're a candidate, and let you know what we can expect after your surgery.
Now, not everyone is a candidate, so who falls in that category?
Typically, if you're pregnant, if you have certain medical diseases, there's a very few reasons not to do it unless it's, and the most important one is if it's not necessary. If it's not necessary, we don't do it.
Okay. And what do you recommend for someone who is not a candidate? Are there other options?
Oh, absolutely. We have non-invasive treatments, neotensil, for example, which is a one-day treatment. We have radiofrequency treatments that last quite a few months after 4 treatments. And so we really offer the wide spectrum because patients don't always have the downtime and may not need surgery.
Right. So, okay. Yeah, I'm very interested in the radio frequency.
Well, we should try it.
It's for the fine lines, right?
It's for fine lines and tissue. It's just for aging. We're just trying to slow down the inevitable.
And let's talk about our patient who's coming in today.
So we have a young lady coming in today. She's 37 years old, and she has a little bit of extra skin hanging over the eyelids, interfering with the lashes, with her makeup, and just making her feel tired every day. And she's in sales, and so wants to appear young and vibrant and just not have that early morning, what's going on here situation.
I have bags over my eyes, and sometimes my eyelids get stuck. And then it also has a cosmetic effect. And so I'd like to get that taken care of.
Is this a genetic thing? Does it run in your family?
Absolutely. My mom has it. She'd kill me for saying that, but my mom does have that problem as well, and so I'd like to get mine corrected before I'm 64, and it really is starting to impede my vision. I've always been bothered by my eyelids just being so heavy and wanting to look more awake, so I'm excited to see what it looks like afterwards. Dr. Zamora, I've known him for years, and he's done several other procedures for me. I trust him implicitly, and he's always just done a beautiful job. I think he marries the art and the science very well, and you need that in a plastic surgeon.
Are you excited?
Oh my gosh, yeah. I can't wait. This was a big day.
And what can she expect when she's done?
She's going to notice an immediate improvement. She, right after the procedure, would be probably comfortable to go out to lunch or dinner today with a pair of sunglasses, and then go home and start icing for the next 2 days. We also use holistic medications like arnica and ledum serum to really decrease the swelling. And in just maybe 5 days, she'll look great.
I'll be back to work. Not a problem. Actually, once I leave here, I'll probably go see another account or two.
Really?
Yeah.
Really?
Yes.
Awesome.
Yeah.
So you're just going to keep moving on with life, and your eyelids will look much better.
Every procedure that he's done, I've been able to kind of carry on and as normal.
It's incredible the things that we can do that are so delicate and gentle and artistic and just perfect. It's the best place to operate, I think.
Wow, you're passionate about this. This is your passion.
I love it.
And that's why you're so good at it.
Well, thank you.
It's like an art. It's like an art. Dr. Zamora really is an artist. He's amazing and a super nice guy. Here are the details again of that incredible offer. You pay just $100 for an eye tightening treatment, but it's only for the first 10 people who call right now and schedule an appointment. So call Dr. Jack Zamora and Cosmetic Surgery Consultants at 303-780-7377. That's 303-780-7377. And you can also learn more online at drjackzamora.com. And he has several locations across the metro area, so call to find the nearest